Sis Hawa, you have made mention of your contribution towards the baby center, which I believe is just a fragment in School of Education. We have over 1,000 individuals that are in School of Education. So over the years, you have in mind that to come and represent the people of Edusa. I see no reason why you should focus on just one fragment. I, as a Cisse, I have been serving, all right, people are my witness in that baby center that you're talking about. We have donated stuffs, all right. Sometimes but people are my witness. So if you said that those are your fragment of people that you've served, or that your service is being realized, I see no reason why you should vie for this particular position, because at the end of the day, those are just fragment. Okay, if you're given this opportunity to come in as a gender minister, I see no reason how you'll be able to handle a good number of Edusans, because you said in your deliberation that it is impossible, okay, for you to be a student and at the same time to participate fully in the affairs of student affairs. But I, as a sister, I am a student and I have been participating fully in the affairs of student of the University of the Gambia School of Education. That has given me an edge to see to it that I am ready to serve no matter what I am up to or whatever I am doing. That is readiness. As a leader, you should be action oriented and you should be ready to serve. If you know that in your conscience that you cannot serve, you should not bother yourself. So today I am telling you that to kindly leave this position and probably focus on your education, because that is more important to you, not the service of the students. You cannot handle it.
Thank you.
Thank you.
Thank you. So, are you going to withdraw?
Never.
Thank you. Okay. So now I'm going to give you the same opportunity. Now you are able to convince the Student Service Council, that is SSC, and they select you as the candidate to vie for the position of Gender and Health Minister under the 16th Executive Council. And there's only one person that is between you and that position, and that person is right here. I'm going to give you 2 minutes to convince that person to go, so that you can go for unopposed in 2 minutes.
Okay, thank you, Prof. My sister Aisha, as you've just said, but I just want to remind you that when it comes to Edusa, women and gender and health, these are key things that we need to look into. So I think you mentioned that you are the founder of Conscious Health or something like that. Mm-hmm. I believe, like, you as a founder of an association, before you give before you give charity outside, you begin from your own home. Let's say, the saying goes that charity begins at home. You've been organizing training on reusable sanitary pads outside, but not inside the School of Education. I won't say you didn't organize it, but was it within the School of Education? Yes, you are providing sanitary pads outside, but not within the School of Education. Aisha, I don't mind, maybe you've been donating things at the baby center, but I've never seen you in the baby center. And if you've donated anything, I've not seen you. I can remember parts came, but from what the name of Renaissance. And that parts were, who did you hand over? Not directly to the Gender and Health Minister. I believe with all this foundation and everything that you have that has to deal with gender and health, before you make impact outside, and you said you are a concerned student within the School of Education, Edusans, charity begins at home. Before you go outside, organizing, inviting 10 Edusans outside there. How many Edusans do we have within the School of Education? Did you include the other gender? No. So this is one of the reasons that I want to tell you that relax and give me this position. I am not only looking at mothers, but I am looking at mothers and Edusans. Aisha, you will not know what mothers are going through because you are not one of them. I've never seen you in the baby center.
Thank you.
So you know what you have done for them.
Thank you. So Aisha, are you going to back up?
Yeah.
Huh? Okay.
I have to
So both of them say that they are not going to talk about it. Give them
Never.
chance to convince each other, but they fail to convince them each other. So now it's left to the Edusa to decide 31st March who among them is going to be your gender and health minister. Advocacy requires courage. Tell us about a time you stood up against a gender stereotype or assist someone in medical crisis.
Okay, thank you so much. This is a critical question, but I'll refer us back to my foundation, or that is our foundation, that is Conscious Health and Hygiene Foundation. So there was a time this young lady, may her soul rest in peace, that is Mariama Caesar, a grade 12 student of Mahad, who was battling with cancer. So they reached out to me personally, not through the foundation, to actually help in raising funds. I tried through my platform, that is the TikTok and my WhatsApp, to make sure that that fund was raised. But before we realized the particular amount that is needed for the treatment, the lady actually passed away. So that is a moment that I have stood for someone that was actually in need. Thank you.
Thank you so much. Honorable C, advocacy requires courage. Tell us about a time you stood up against gender stereotype or assist someone in a medical crisis.
Yes, like 2 weeks ago, that was when we resumed for lectures. This was a student, year 1 student, who just came to school and was fasting. Immediately the ball stopped, and then she was trying to calm down, but she was feeling dizzy and then could not walk towards the school. Despite she wanted to go to school of she wanted to go to SAS, but she wouldn't walk because of the fact that she have been standing for a long journey, and I don't know if it was due to dehydration or so. I supported her, escorted her towards the sick bay, but then unfortunately they were not available. So we took her to the space down there, spread the mat, help her to take some water, and then call the parents to come for her. Though there was no ambulance to come and help her, so we were able to contact the parents, and then they drove to come and pick her. This is the only one anyway.
Thank you. Good evening, our viewers across the Gambia and the students joining us from the University of the Gambia. We are in Fine TV Farato Studio. I'm your moderator, Seymour Fati. We bring you the policy debate of 2026 Education Student Association. And to continue with the debate today, we bring you the position of the Gender and Health Ministry. We all know Gender and Health Ministry are the ministry that is going to be responsible for the conducive environment in our campus. They are the one that is going to provide and all the students to be in a better shape so that they can enjoy their lectures across the four corners in Faraba, Banta. And we all know that the health is wealth, and every student needs to be healthy, and we need the healthy environment. We have our own school now, and that is the School of Education, and we know that that responsibility is going to lie under the 16th Executive Council Gender and Health Ministry. So we have candidates that are vying for this position to continue the works that the 15th Executive Council started and other councils that come before them, so that we can have a better environment and a healthy environment for every student that is going to Faraba. So we have two candidates that are from the two different camps. We have a candidate that is from the Team Renaissance, and we have other candidates that is from Student Service Council, known as SSC. So I'll give them the opportunity to introduce themselves, and then we hit the debate rolling. So I'll start with the candidates in my right hand side. Honorable, you can introduce yourself to Edusans.
Thank you so much, Prof. Fati. Good evening, great minds of Edusa. I am Aissatou Cisse. I am a 4th-year student, University of the Gambia School of Education, majoring in English language and minoring in human resource management. I am also part of the 23rd Executive Council of the University of the Gambia Gender and Health Ministry, and also a former gender focal person for Peace Ambassadors West Coast Region. And I am the founder for Conscious Health and Hygiene Foundation, and also a head coach for the Edusa beauty pageant 2023-2024. Thank you so.
Thank you so much for that wonderful introduction. Now to candidate on my left hand side. Honorable, you can introduce yourself to Edusa.
Okay, auzubillahi minash-shaytanir-rajim. Assalamu alaikum. Greetings to the management of Fine TV. Good evening, Prof. Omar Fati. Good evening, Edusans, especially the electorates. Greetings to my chair lady and then my campaign manager. My name is Awasi, the aspiring candidate for gender and health under the most brilliant team, SSC, which is Student Service Council. Thank you.
Thank you so much, Honorable, for that wonderful introduction. Now, Honorable Cisse, you are vying for the Gender and Health Ministry, and that one is not a child play ministry. We need that ministry, and every Edusan need that. And then we want you to tell the Edusan your educational background as well as your track record up to university level.
Okay. Thank you so much. Just like when I started my introduction, I have made mention some of my track records. So to start with your question, I am a former gender focal person for Peace Ambassadors West Coast Region, and I am the founder for Conscious Health and Hygiene Foundation, a foundation that is there to raise awareness on gender and health related issues, on reproductive health, making of reusable pads, and raising awareness on personal and menstrual hygiene. And also, I am part of the 15th Executive Council of the University of the Gambia Gender and Health Ministry, and I am also the head coach of Edusa beauty pageant that is from 2023 to 2024. I am also the assistant program officer for Support and Mentor Foundation. So these are some of my track records that I will want to mention. Thank you.
Thank you. Now let's go into your educational records, your educational background, from where you start up to University of the Gambia.
Okay, I started my senior secondary school in Sekhamdan, 2015, 2018, and I was enrolled into the Gambia College 2015, 2018, and also from the Gambia College, I was posted at URA, that is Chamoy Bunda, upper basic school, where I spent 2 years in Chamoy Bunda, that is Wulli West. And also I came to Koba Kunda in 2019, where I spent 1 year. From there, I was enrolled in the university up to date. Thank you.
Thank you so much for that. And Honorable, you are vying for the Gender and Health Minister, and Edusans want to know who is vying for this position. Can you tell us your track record as well as your educational background?
Okay, to begin with, as I said, my name is Awasi. I attended Nusrat Senior Secondary School from 2009 to 2012. From there, I proceed to the Gambia College from 2012 to 2015, and then I majored Science and Agriculture. From there, I proceed to Lasting Solutions, where I did my diploma in IT, networking, and then Computer A+. From there, I proceed to Inside Training Center, where I did garment making, that is tailoring. From there, I also proceed to Gain Your Skills Academy, where I became a professional tailor and also became the CEO of Hours Tailoring and Fashion Idea. I am also a 400 level student, majoring in English language and also a minor in human resources. Looking at my track records, for the schools that I have been, I've been teaching in different levels, ranging from the primary, junior to the senior. In Latrikunda Upper Basic School, I've always served as a teacher coordinator for peer health, where I've always been supporting young girls to be conscious of their health and then menstruation, and in particular their reproductive health. Whilst I was in Latrikunda Upper Basic School, I've moved or worked with young girls in which I help them to maintain hygiene within the school environment and also at home. And also, I've also served as the school rep for a group of ladies called Team of Extraordinary Ladies. This is a team that helps to supply sanitary pads to young girls, especially in Region 1. Whereas in Latrikunda Upper Basic School, we distribute sanitary pads to students monthly to help them maintain menstrual hygiene and also help them to be able to access sanitary pads. As we know, some students have little knowledge when it comes to menstruation. So this initiative or these programs have been implemented in schools to help young girls to be able to help themselves when it comes to menstruation and reproductive health. And also in the University of the Gambia, I am a member of the Nursing Mothers Association, in which I support women in terms of accessing sanitary products, especially sanitary pads. And then to cut it short, anyway, these are my track records, and thank you.
Thank you so much for that. Now to Honorable Cisse. Honorable Cisse, we want to know, especially the Edusa that are watching and that are going to watch. We have different, almost 11 different positions under the 16 Executive Council. What motivates you to vie for the position of Gender and Health Ministry in 2 minutes?
Thank you so much, Prof. I am a young passionate passionate about health, because I believe that health is personal and gender equity is essential, and also student representative is non-negotiable. So me vying for this particular position is not just mere want, but my passion for gender advocacy and also health advocacy. I have been serving in different capacity outside of the University of the Gambia School of Education. So if I can serve those people with dedication, with vision and with action, I believe that my school, that is Edusa, should not be an exception. So that is why I said to myself, I have to come back and serve these people, because over the month, I have not seen any specific or any improving action in this ministry, any improving action in this ministry. So me having the knowledge and the passion for health and gender, why not I come and improve this particular ministry for the betterment of Edusa? That's why I am here today. Thank you.
Thank you so much for that. Honorable, there are 11 different positions under the 16 Executive Council. Why vying for Gender and Health Ministry?
Thank you very much, Prof, for that question. Anybody that knows Awasi knows me for supporting health, knows me for supporting women. For the past 10 years, I've been teaching, as I said, in different schools. And whoever knows me knows that I work with young girls. I support young girls. I support young girls in making key decisions, especially when it comes to health and gender. So one of the reasons that make me come for this position is because looking at it in the University of the Gambia, as a victim or as one of the mothers in the university, I know what mothers go through, and I know what consequences or what health issues we discuss when we sit together. So being a member of the Mothers Association or a member of the Nursing Mothers Association, having conversations with them, hearing their voices or hearing their issues, these are some of the things that make me come up to represent the student, not purposely as a team, but generally to help women, especially Edusans, to represent them, to help them achieve their voices.
Thank you so much. Thank you for that. Now, Honorable Cisse,
Yes.
you are vying for the position of Gender and Health Ministry. What have you done for Edusa? And I want this question to be answered only in the four corners of the university, not what you have done outside the university, but what have you done for Edusans in order for them to trust you to vote as the next Gender and Health Minister in 2 minutes?
Thank you so much. Let's say ISA is a household name within the School of Education and the university at large. So coming to my achievement or the things I have been doing for the School of Education, through my pragmatic team, that is Team Renaissance, we have helped the gender ministry by donating pads. And also through my foundation, that is the Conscious Health and Hygiene Foundation, one of my projects, I have invited over 10 students from the University of the Gambia School of Education to train them on how to make sanitary pads. And under the 23rd Executive Council of the University of the Gambia Gender Ministry, which I am a part of, on the World Menstrual Hygiene Day, we train over 60 individuals on how to make reusable sanitary pads, which I am a center of. I am part and parcel of that process. So wherever Edusa calls, I am there. So that is why I said I am a household name in School of Education. Even those in denials knows that ISA is a household name, and ISA have been impacting the life of School of Education students in her capacity. Thank you.
Thank you so much. Honorable C, you are vying for the position of Gender and Health Ministry. And I want this answer to be only in the four corner of the University of the Gambia, especially education, School of Education. What have you done for the Edusans before vying for this position in 2 minutes?
Yes. You cannot be a student and say you will be fully participating in everything that happens within the school. Yes. My efforts or my activities are realized within the mothers, or my appearance is noticed within the nursing mothers or in the baby center. I've been actively supporting parents or mothers in the baby center by helping them keep their babies for them when they want to go to class, especially when they do not have the funds or the money to pay for the nannies. So I will volunteer. That is, if I'm not going to class, I'll volunteer, take their babies, keep the babies for them until they go to class and then come back. And then I've also been helping mothers to be able to have sanitary pads, because if you come to the baby center, normally we make a monthly contribution. That monthly contribution, we use it to buy omo and other sugar and other stuff that we may need in the baby center. So before, there was nothing. When we started bringing our babies in the baby center initially, there was nothing at the baby center. We only have mats. But thank God, with the help of the former president, Malcolm, he was able to provide us with kettle and then also a flash, which we use to prepare food for our babies. So with that contribution, despite the fact that I don't still have a baby in the baby center, but I still visit the baby center up to date. So when I go, anything that is not available and I feel I can contribute, I've been contributing, because I know how it feels to be a mother. I know how it feels to come to school with a child and want to manage your assignment, and they also want to attend lectures. Sometimes it is very, very frustrating. So this is where my services are rendered. And again, these sanitary parts usually is kept by the nannies, so that any mother or any student that come and find the sick bay locked or the personnel are not available, you can always access these parts through the nannies or anybody found in the baby center. So this is where my services are.
Thank you.
Thank you.
Thank you so much. Asa, now I will give you 2 minutes to convince your sister here, because you are able to convince Team Renaissance and they select you to come and become the candidate for Gender and Health Minister under the 16th Executive Council. And there is only one person between you and that position, and that is your sister right here. So I will give you 2 minutes to convince your sister here to withdraw, and you go for unopposed right now. So I want you to talk to her so that this policy division will not even continue.
Thank you. Thank you so much.
In 2 minutes.
Prof. Okay. Sis Hawa, you have made mention of your contribution towards the baby center, which I believe is just a fragment in School of Education. We have over 1,000 individuals that are in School of Education. So over the years, you have in mind that to come and represent the people of Edusa. I see no reason why you should focus on just one fragment. As a Recise, I have been serving. All right, people are my witness in that baby center that you're talking about. We have donated stuffs. All right. Sometimes but people are my witness. So if you said that those are your fragment of people that you've served, or that your service is being realized, I see no reason why you should vie for this particular position. Because at the end of the day, those are just fragments. Okay, if you're given this opportunity to come in as a gender minister, I see no reason how you'll be able to handle a good number of educents, because you said in your deliberation that it is impossible, okay, for you to be a student and at the same time to participate fully in the affairs of student affairs. But I, as a sister, I am a student and I have been participating fully in the affairs of student of the University of the Gambia School of Education. That has given me an edge to see to it that I am ready to serve no matter what, no matter what I am up to or whatever I am doing. That is readiness. As a leader, you should be action oriented and you should be ready to serve. If you know that in your conscience that you cannot serve, I mean, you should not bother yourself. So today I am telling you that to kindly leave this position and probably focus on your education, because that is more important to you, not the service of the students. You cannot handle it.
Thank you.
Thank you.
Thank you. So, are you going to withdraw?
Never.
Thank you. Okay. So now I'm going to give you the same opportunity. Now you are able to convince the Student Service Council, that is SSC, and they select you as the candidate to vie for the position of Gender and Health Minister under the 16th Executive Council. And there's only one person that is between you and that position, and that person is right here. I'm going to give you 2 minutes to convince that person to go, so that you can go for unopposed in 2 minutes.
Okay, thank you, Prof. My sister Aisha, as you've just said, but I just want to remind you that when it comes to Edusa, women and gender and health, these are key things that we need to look into. So I think you mentioned that you are the founder of Conscious Health or something like that. Mm-hmm. I believe, like, you as a founder of an association, before you give before you give charity outside, you begin from your own home. Let's say, as the saying goes, that charity begins at home. You've been organizing training on reusable sanitary pads outside, but not inside the School of Education. I won't say you didn't organize it, but was it within the School of Education? Yes, you are providing sanitary pads outside, but not within the School of Education. Aisha, I don't mind, maybe you've been donating things at the baby center, but I've never seen you in the baby center. And if you've donated anything, I've not seen you. I can remember parts came, but from what the name of Renaissance. And that parts were, who did you hand over? Not directly to the Gender and Health Minister. I believe with all this foundation and everything that you have that has to deal with gender and health, before you make impact outside, and you said you are a concerned student, within the School of Education, Edusans, charity begins at home. Before you go outside, organizing, inviting 10 Edusans outside there, how many Edusans do we have within the School of Education? Did you include the other gender? No. So this is one of the reasons that I want to tell you that relax and give me this position. I am not only looking at mothers, but I am looking at mothers and Edusans. Aisha, you will not know what mothers are going through because you are not one of them. I've never seen you in the baby center.
Thank you.
So you know what you have done for them.
Thank you. So as are you going to back up?
Yes.
Okay.
I have to laugh.
So both of them say that they are not going to back up. I give them a chance to convince each other, but they fail to convince them each other. So now it's left to the Edusa to decide 31st March who among them is going to be your Gender and Health Minister. So they both cannot convince and they both want to go forward with their policies and their programs. So now, I will give you 5 minutes to talk about your policies and your programs to Edusans and give them the reasons why they should vote for you to become the 16th Executive Council Gender and Health Minister. So you have 5 minutes to talk about this program. And
thank you so much. I think before I go into my policies, I have to make something clear here. So now, my sister has already vindicated herself that your being absent is really clear. And Edusans are watching. All right. So if you're telling me that you have not seen me organizing or giving what should be given to the School of Education students, I think you have really been absent. I made mention, we have trained over 60 educants on World Menstrual Hygiene Day on how to make reusable sanitary pads. And also, I invited 10 students, not only one gender. I think you need to go back to your camp and verify this. Not only one single gender, because I don't focus on that. People that knows me knows that I am very much gender sensitive. You understand? And regarding the baby center, go back. You said you're a committee member. I want you to go back and ask questions about ISA, whether I have donated or whether I have not donated or whether I have been visiting or not. So yes, education students, you cannot leave power into the hands of my dear sister, because she will never have the time to render that service that you need. So let me dive into my policies. One on the list of my policies is ending period poverty. That is making sure that we embark on making reusable sanitary pads, in training educants on how to make reusable sanitary pads. That is to equip educants, because I believe that educants, 90 to 95% of educants are teachers, and if they are equipped with this skill, at the end of the day, they will be sent to different communities wherein, if they do not keep these skills within them, they will be able to help those individuals that are less privileged in combating period poverty. Educants are nation builders. So if those people can be equipped with these particular skills, I believe one step at a time, we will be able to end period poverty. So as a gender minister, we will advocate for inclusivity and diversity by making sure that we organize symposiums through the research and education minister, in order to orient educants on having the right information on health related issues, reproductive health, sex education, personal hygiene, and menstrual hygiene. And for the first time in the history of Edusa, we will celebrate World Mothers, that is World Breastfeeding Day, to tell our mothers that they are brave, they are courageous, and they are resilient. And also, this is going to be championed by our fellow male counterparts that are going to be with us in the council. Through the University of the Gambia Red Cross link, we will organize first aid training. This is not just going to be any first aid training. This is going to be a substantial first aid training that is going to equip educants on basic first aid knowledge. And priorities is going to be given to PWDs, that is people living with disabilities, and nursing mothers, in order to be able to tackle emergencies at their disposals. So educants, these are not just mere policies, because I believe student representation is non-negotiable, and policies are things that are life-changing rules. When you mention them, you should not just say them just for the sake of political gain or just for the sake of seeking sympathy. And also, like I said, we will close the gap in the gender mainstreaming by making sure that we collaborate with potential stakeholders. Right now, I am in contact with the student union of the medical student of allied sciences. So when we are voted into the office as your gender and health minister, I will make sure, or we will make sure, that we collaborate with this expert to bring the best in the studentship of Edusa. Thank you so much.
Thank you so much for that. Now, Honorable C, I will give you 5 minutes to talk about your policies and program. This is an opportunity for you to convince the Edusans to vote for you to become the next Gender and Health Minister under the 16th Executive Council. So you have 5 minutes to talk to the Edusans about your policies and your program.
Thank you very much, Selma. Edusans, I just want you to quote from my opponent, Aisha. If you read between her lines, she's trying to discriminate me of being a mother. She's saying that I should focus on my academics because I am a mother. I will not have time for Edusans, which is a no. I am ready to serve, and I will serve till the till the end of the year, inshallah. Besides, my policies are 5. If time permits me, I'll be able to discuss all of them. But just to discuss them one after the other, one of the first policy is gender and health related activities. As part of the function of the gender and health minister, it is our responsibility, if voted in office, it is my responsibility to make sure that there are programs that has to do with gender and health. So this is going to be carried out through the health day. So in this health day, we want to make sure that we bring trending issues that are affected women in the University of the Gambia and Edusans at large. Last year, if you could remember, there was a health day, and which Aisha says she's a health advocate, and I didn't see her. I didn't know whether she was present or not. And then the facilitator of that health day, Dr. Amadi Sow, I've worked 2 years under him when he was at the MRC unit in Serakunda General Hospital. So some of you that were in that health day, you could realize that I was able to clear the doubts of most of these Edusans when it comes to health and health related issues, especially STIs. So we want to bring back this training, but this time around, we are not looking at HIV. There are other STIs that are affecting women and girls, and this has to do with infections. Ladies, we know what we mean when we say infections. Infections are affecting both men and women, and this is if we do not have healthy relationships. And any of us is either in one way or the other engaged in a relationship. So with the help of this health day, we'll be able to have knowledge, especially when it comes to health and STIs. Last year, it was on HIV. This time around, we are talking about infections that are affecting us as women. So the other policy that I have is we want to enhance child well-being, especially when it comes to babies that are in the baby center. Ladies and gentlemen, last year we had a training on exclusive breastfeeding. This time around, we want to bring training on the making of baby cereals. These cereals, we want to collaborate with other partners to help us, especially mothers, to be able to prepare meals or nutrients that are rich enough to help our babies, after which we breastfeed them for 6 good months. We all know how difficult it is to be able to buy these baby feeds. It's kind of costly, and sometimes we find it difficult to manage it. And as Edison, some of us are fathers, others are mothers. So we are either directly or indirectly affected. So the other policy that I have there is what we want to have training on the reusable sanitary pads. Already we have a collaboration with the gender unit from the GTU, and the last time we had a training, I was able to attend the training through the help of Elizabeth, that was the former gender and health minister. So we want to expand it. I believe that Edusans, we don't have problem when it comes to how to use these pads, but how do we do it with the proper hygiene? So this is where our problem lies. But as we said, teachers are nation builders. If we have the knowledge on how to prepare these sanitary pads, we are all going back to different regions. We either help our children to manage costs, or we help our students. So with the help of this training, this is going to help us to be able to maintain a healthy lifestyle. The other policy that I have is under guidance and counseling. Fellow Edusans, most of us find it very, very difficult to make decisions that has to do with our academics and our home. Some of us are managing home and studies, which is very, very difficult. So we need people out there to guide us to make decisions, and with this we want to bring the lecturer for the guidance and counseling services, which is Mrs. Aissatou Diouf. We want her to help us, especially with matured students, to be able to tackle issues when the need arise.
Thank you.
Thank you.
Thank you so much for that. We both had their policies and program. Now it's left to the Edusans to decide who is going to be their next gender and health minister under the 16th Executive Council. Honorable CC, Section 23 says prevention is better than cure. What specific health education program will you launch to help students manage the stress of Faraba Bantan?
Okay, thank you so much. And before I go into that question, my dear sister, if you want to seek for sympathy votes, do it in another way. I am not telling you that you're not competent because you're a mother. I sitting here, I am a proud mother of a 5-year-old boy. And I am coming to school. I am rendering services to the School of Education. So if you don't know that, let me put that to your knowledge. Thank you. And to the question, prevention is better than cure. What specific health education program will you launch to help students manage the stress of university life? So, like I said, I am the founder of a Conscious Health and Hygiene Foundation. This have been things that we have been doing, we have been rendering to people. So when we come to the office, what we bring to the people of Edusa is to partner with the Education and Research Minister to organize health talk shows, that is symposiums, seminars on reproductive health, personal hygiene, sex education, which I believe most at times we feel shy of talking about them. So if we can bring those things on board and discuss it with our fellow students, I believe Faraba Bantan campus, especially School of Education, will be an amazing environment where we are going to get right information from right people. Thank you.
Thank you so much. Honorable C, Section 23 said that prevention is better than cure. What specific health education program will you launch to help the student manage the stress of Faraba Bantan if you are elected as the minister?
Yes, as I mentioned in my policies, through the help of the guidance and counseling services, I believe with this, it can help us manage the stress, because in guidance and counseling, whoever is out there to guide you need to have the empathy to be able to listen to you, to be able to guide you, and also to be able to help you make decisions that are going to help you achieve your goals. And again, through the with the help of the Health Day, we can still bring this program, we can still bring sessions that are going to orient people on how to live comfortably in Faraba Bantan, because there's a saying goes that health is wealth.
Thank you. You can keep the. If you look at your ministry, combine the word gender involved both male and female. Do you have any policy for male? Because all I'm hearing is female nursing mothers, part periods. Do you have any policy for male students at the University of the Gambia School of Education?
Yes, you know, I told you I have 5 policies, but all cannot be discussed due to time. So one of the policies that include the other gender, that is the male, we have, remember, as gender and health, we are talking about inclusivity and diversity. So as I said, one of my policies, we are already trying to create a bigger space where students can go and relax. If you look at Faraba Bantan, after lectures, you have nowhere to go and sit and relax. Our students are always running towards the bus stop. And you either go to the cafeteria and eat where sometimes it is always crowded. Other than that, we don't have a space. So this is why we're also trying to, as one of our policies, if we are voted in office, we want to create a bigger space for the other gender so that they can relax, do their assignments, eat when necessary, enjoy their internet, and then do their assignments. So these are also policies that include them. Remember, we also have a policy on the training on reusable sanitary pads. This knowledge does not only stops within women, it goes beyond. Okay, so this has to benefit both the male and the female. So all these policies are inclusive and diverse.
Thank you. However, we see your ministry, if you are elected, the word gender involve both male and female, and then all what I'm hearing here is female and then nursing mothers parts and here and there. Do you have any policy for the male students at the University of the Gambia School of Education?
Of course, Prof, I am gender sensitive, like I said. But it seems like my sister here is really misunderstanding the role of a logistic minister and that of a gender minister. How can you create a bigger space? Like we're talking about how are you going to include the male gender in your policies? Not actually creating a bigger space where they are going to read. I think leave that one to the logistics; they will handle that. So to the question, yes, that is partnering with the University of the Gambia Red Cross link through the Gambia Red Cross Society to organize first aid training, wherein both genders are going to be part and parcel of this training to acquire the knowledge that they need to address emergencies at their disposal. And yes, ending period poverty, I told you, we are going to train every interested Edusans on how to make reusable sanitary pads, because I believe that at the end of the day, they will be posted in different regions wherein they will inculcate those skills into the young ones or the less privileged. So yes, my policies are very diverse, they are inclusive, and they are gender sensitive. Thank you.
Thank you. You can keep the mic. Sometimes the University of the Gambia, especially School of Education or other schools, can be hostile. Now, if you have a student that want to be a whistleblower about the sexual harassment from both the students or the lecturers, and if they approach you, how are you going to handle that without, giving their names or their identity to the general public?
It seems like I know that this question will be coming. That means I have been doing my assignment real good. So yes, as a gender minister, if that particular person comes to me, that is called GBV, that is gender-based violence. So if the person comes running to me, what I will do is to make sure I sit with the person, know the root cause, console the person, because I believe that good words always console the heart. And in this world of uncertainties, you have to be calm in handling things. And I am that calm and approachable individual. So from there, if the need be, I will link the person to experts that can handle this matter in a professional way. Thank you.
Thank you so much. Now, Honorable C, if you are elected as the Gender and Health Minister, and then we all know the university life sometimes can be hostile. If a particular student come to you that there is a harassment towards them, and they confide that to you, how are you going to solve that problem, and while you don't disclose their identity?
Yes, thank you very much for that question. I think this question is almost treated last semester when we were doing guidance and counseling. With the knowledge gained from guidance and counseling through the help of Madam Aissatou Diouf, there are different ways to help people, especially when the need arises. First of all, you need to be able to listen to them. In listening to them, there are characteristics that need to be with you. You cannot say you are a calm person when actually people know you are not that calm type. So if you tell us you are calm and we know who you are, it means you are just making noise. So to be able to solve that problem, first of all, already as I mentioned in my policy, we want to establish a guidance and counseling service. But this time around, we are bringing an experienced person. So we go to that unit, sit with you, listen to you. We make sure that we help you bring down the level of that issue. As you know, gender-based violence is one of the trending things in this country. So to be able to tackle it, you have to follow certain procedures. So with the help of the guidance and counseling services, we'll be able to help that person without revealing the identity of that individual. Thank you.
Thank you. Honorable C, if you go to University of the Gambia, we have different schools. And if you come to education, our comfort zone is the most talk about comfort zone, because you can go there anytime. Here, what I mean comfort zone is the toilet, and that will be under your ministry. How are you going to make sure that still the cleanliness continue under the School of Education?
Thank you very much. I think if you look at the function of the Gender and Health Ministry, it is the responsibility of the Gender and Health Ministry to ensure that the toilets, especially the environment, is clean and comfortable for all students. So I think when it comes to the toilet, with the help of the former ministers from Elizabeth to Fatima, we don't have a problem with the environment. So to continue with that trend, I think we need to continue with what? The sensitization. sensitization in such a way that it is done through what media platforms, helping students to know where to put the parts after which it is being used. So if you look at the toilets, this is why, as also part of my policies, um, we also want to help the students to have a mirror to be able to adjust themselves whenever they visit the toilet. So when it comes to the sanitation of the toilets, through sensitization, through media platforms, through flyers, this can help us to continue having a conducive and a clean environment within the School of Education. And this time around, we even want to help other schools to also improve from the School of Education, because if you look at other schools, they will tell you, if you go to other school, they will tell you that I want to go to School of Education and use their toilets because of what the environment we have in School of Education. So sanitation is not a big deal when it comes to gender and health minister, especially with the former ministers. Thank you.
Now, Honorable C, have you ever cleaned toilets before?
Yes, I've helped Elizabeth. That was like a year before Fatima. When Elizabeth was serving, there was a day there was water shortage in the school. By then, we were new in Faraba, and then we were fetching from outside to bring water to the toilets.
Thank you.
And I've never even think of contesting for this position, but I feel that everybody would like to use a clean toilet.
Thank you.
So this was why I did it. Thank you.
Thank you so much. Honorable Cisse, we have different schools at the University of the Gambia, and if you go to School of Education, our comfort zone is the most talked about comfort zone. Here I mean the toilets. I'm referring to the comfort zone. Now, if you are elected as the Minister of Gender and Health, it's going to be under your custody. Are you going to maintain that cleanliness?
Yeah, inshallah. In fact, it is part of my policies to have a cleaning exercise in every fortnight. That is to complement the effort of the management in making sure that the environment of Edusa is clean and tidy. Because I believe that cleanliness is next to godliness. So if we continue or if we maintain our environment clean, it is going to be reciprocating to our lives. So yeah, that is part of my policy.
Thank you. Have you ever participated in cleaning the toilets before?
Like always, I am always in the forefront when it comes to Edusa. Yes.
All right. So it does mean that anyone that come in as the Gender and Health, we will have the best toilet facility, and you can even go there and have your breakfast. Yeah, you don't mind, you know. So Edusa, you know, is always a place to be. Now, to Honorable Cisse, advocacy requires courage. Tell us about a time you stood up against a gender stereotype or assist someone in medical crisis.
Okay, thank you so much. This is a critical question, but I'll refer us back to my foundation, or that is our foundation, that is Conscious Health and Hygiene Foundation. So there was a time this young lady, may her soul rest in peace, that is Mariama Caesar, a grade 12 student of Mahad, who was battling with cancer. So they reached out to me personally, not through the foundation, to actually help in raising funds. I tried through my platform, that is the TikTok and my WhatsApp, to make sure that that fund was raised. But before we realize the particular amount that is needed for the treatment, the lady actually passed away. So that is a moment that I have stood for someone that was actually in need. Thank you.
Thank you so much. Honorable C, advocacy requires courage. Tell us about a time you stood up against gender stereotype or assist someone in a medical crisis.
Yes, like 2 weeks ago, that was when we resumed for lectures. This was a student, an year 1 student, who just came to school and was fasting. Immediately the bus stopped, and then she was trying to calm down, but she was feeling dizzy and then could not walk towards the school. Despite she wanted to go to she wanted to go to SAS, but she wouldn't walk because of the fact that she have been standing for a long journey, and I don't know if it was due to dehydration or so. I supported her, escorted her towards the sick bay, but then unfortunately they were not available. So we took her to the space down there, spread the mat, help her to take some water, and then call the parents to come for her. Though there was no ambulance to come and help her, so we were able to contact the parents, and then they drove to come and pick her. This is the only one, anyway.
Thank you. Now, in University of the Gambia, we have disabled, people with disabled, and then you know that the way the campus are, especially our facilities, are not, favorable for them. As a minister, if you are elected, how are you going to help those people with disabled?
Anyway, this is a very critical question. But as I said, our policies are inclusive. We want to make sure that everybody in the School of Education will benefit. And we should tell you that the lifters are already set, which are going to help students to travel, to move the stairs, to be able to attend lectures. But as I said, with these policies, I know they are not sidelined. All the policies we have, they are inclusive, and then we will make sure that they are actively involved when it comes to achievement of these policies.
Thank you. Honorable Caesar, University of the Gambia, we have different students, and then we have students that are disabled, and the structure there is not favorable for them. Now, if you are elected as the Gender and Health Minister on the 16th Executive Council, how are you going to help these people?
Okay, thank you so much. So looking at that, our powers are limited. All we can do is advocate. So at the moment, the lifters are in process, and we believe that by the end of this semester, they will be in use. So for the policies, my policies, they are included 100%. I do not leave them behind. So for the structures, all we can do as student leaders is to advocate. Thank you.
All right, thank you. And then if you look at the section 23 says that the law demands students to sick bay. Where exactly will this be located, and how will they access, especially the new students? If at all is there in the school, how are you going to make sure that the new students know that this is the sick bay in their first day or during the orientation?
Yeah, thank you so much, Egoma. So the sick bay is already there, which I am part of the committee, like I said before. So what we can do during the orientation day is to make sure that we show them the place, because at the end of the day, if they come for the orientation, they are there physically, and at the end of the orientation, we usually take them around to show them different facilities that they can access as new students. So when they are on the ground, we will make sure we show them, and as time goes by, we can actually create cards that will direct them where the sick bay is. Yeah, thank you.
Thank you. Honorable C, the section 23 demanded that the students have access to sick bay, especially the new students. Now, if you are elected, how will you make sure that during the orientation, these people know that this is this place called sick bay?
Yes, during orientation, it is important to help the new students know some of the facilities that are available in the school. So, just as my opponent mentioned, we take them round, and then you can, if you look at the sick bay, it is a bit isolated, and I think that sick bay is for the entire university. It's not purposely for Edusans, but when we say Edusans, we are also part of the university. So once the new intakes are there during the orientations, after which they are brief about the school, so it is important that we take them round. Those that are not fortunate to attend the orientation, we can always put flyers to help them in the directions of the sick bay.
Thank you.
Thank you.
Now, this is going to be my final question before I'll give you the opportunity to ask each other. This question is from the Edusans. They say that you, Honorable C, if you are elected as the next Gender and Health Minister, you will serve only your camp and you will be biased. What do you have to say about this?
Thank you very much. I think I've been well prepared for this question. Edusans, I came through a camp. I am going to serve Edusans because Edusans are those that I am representing. I came through a camp, but I am not serving a camp. I am serving Edusans. I know what it means to be a student, and I've made promises to students through policies. So once I am in office, I am not looking at SSC or Renaissance. I am ready to work for the betterment of Edusans. Thank you.
Thank you. This is going to be my final question to you, Honorable Cisse. This question is from the Edusans. They say that if they elect you and you become the next gender and health minister, you will serve, you will come. That is Team Renaissance. What do you have to say?
All right, thank you. Like I said before, and I'll repeat that again. I'll repeat it. Sorry. Health is personal, and also health is not politics. So when I am voted into the office, I will make sure that I vote, I lead with neutrality, I lead with purpose, I lead with vision, and I lead with action or with policies. I will not look at the camp that have brought me. I will wear the cap for Edusans to see. That is neutrality. Thank you.
Thank you so much. That brings us to the end of the question and answer section. Now I'll give them the opportunity to ask each other. So I'll start with Isa. You have two questions, but you will ask one and she will answer. She will also ask, you answer, then you go to your second question. So you have only 1 minute to answer the question. So
thank you so much. So to my political opponent, this question is goes like this. In the case that you experience an emergency, that is someone that have been is an asthmatic patient, and you are the health minister on the ground, what are you going to do to assist this particular person?
yes, in 1 minute, please. No?
Thank you very much, Aisha, for that question. If you look at asthmatic patients, once they have an attack, you have to look at the environmental factor. So once you have a student, as you said, that is a victim, the first thing that I am going to do is help the person to lie on a flat ground, remove all the tight fittings that are attached to her. If it's a lady, we make sure we remove the bra. If she's wearing a tight clothes, we try by all means to lose it. With the room we are, we try to make sure that it is well ventilated. If the person is finding it difficult to breathe, we can use local fan to fan her so that she can have enough air. And if she is not still responding, we can still allow her to relax. And then once we observe that she's still struggling with it, we can check or ask our friends if there is any medication necessary. If there is no medication, already we have the sick bay. So we contact the sick bay, we brief their professionals that are trained, and then they will help us. If it's necessary for us to take her to the hospital, we obviously call the parents or the guidance or the friends and then transport her to the hospital. I hope I answer your question.
Oh.
Now that is your turn to ask, and you have 1 minute and 19 seconds to answer the question.
Okay, Aisha, my question is, last year you contested for the same portfolio, and then you had policies, and then you said your policies were smart, right? But let's say you did not have the opportunity to serve Edusans. So all those policies, after which Edusans did not vote for you, you went back and sit and fold your hands, relax. Why?
Okay. Thank you so much. Yeah. Before that, I think I have to take you back a little bit. My question have not been fully answered because in that case, if a toilet patient is brought to you, you might put yourself in jail. So you are acting as a professional without seeking for support. All right. So I will have to school you a little bit on that. But let me answer the question before my time elapses. So you said I came and I lose. You know, I believe 85% of Edusans voted for me in office. That is why I did not leave them on their own. Anytime Edusa calls, I am there. I contributed in the development of that gender and health ministry. Okay, even those in denials knows that I have contributed a lot towards the development of the gender ministry. So yes, I did not fold my hands. I have served the people of Edusa, and they have seen my effort countless times. I have represented them in platforms. that you were never seen. I am always in the forefront of any activity that Edusa is doing. So you cannot tell me I have folded my hands and looked at the people of Edusa that have voted for me. I did not do that. Because I was not voted, my powers were limited. You understand? But then the little I could contribute towards the development of Edusa, I did that to the best of my ability. Thank you.
Thank you. Now it's your turn to ask your final question. This is your final question.
Okay.
And make sure that is your final question.
So, in an event that you experience a person that comes to you and this individual have been abused or has gone through GBV, that is gender-based violence. So, you as a gender minister, what are you going to do? First, this is a pregnant question. I want you to listen. What are you going to do? And also, which number can you give to this particular person to contact for further help or for further inquiries? Thank you.
Yes, Honorable. In 1 minute, please.
Can you come again?
Okay. You as an incoming gender minister, you have an individual that comes running to you that he or she have been sexually harassed, that is going through gender-based violence, okay, within the walls of the School of Education or the University of the Gambia in general. What are you going to do as a gender minister on that spot? And if the need be, there is a particular number that have been launched by the government of the Gambia to help victims of gender-based violence. What number is this?
Okay.
Yes, in 1 minute, please.
Thank you very much for that question. I think this question is being repeated.
Okay.
Because Prof asked this question. Yes. Once a student or a victim of gender-based violence run to me for support, yes. As I said, already we have a guidance and counseling services. So we'll bring this person, make sure we are able to listen to this person. In listening to this person, we don't only listen to respond, but we listen with empathy to identify what exactly has went wrong with this person. So once we identify the problem, or we are able to listen to this person and then gather information, the next thing is we link with, we collaborate with other organizations that are above us. Remember, we are within a school. This is a university and this is Edusa. Before we move outside, we link with the Gender and Health Minister for SU, and then we collaborate for collaborate with other organizations that are above us.
Thank you.
This number that you are talking about when it comes to gender and health, I don't know this number. The number I know is for gender and health, for emergencies. That's all I know. Maybe you can educate me if possible. And again, please say, Prof, allow me to speak out, please. Aisha said she has been serving Edusans. I don't deny it. She said, where I am not present, I am not a fancy of
I'll give you time for
I am not attending programs for people to see me. I am not there to show up. So you cannot justify that I did not attend programs.
I will give you
What is your justification?
To say that at the end of the program. Okay. Now it's your turn to ask your final question, and make sure that is your final question.
Thank you.
And then you have 1 minute.
Okay, Aisha, as the founder or CEO of Conscious Health and Hygiene, can you tell me what is the most trending health issue when it comes to reproductive health that are affecting women and young girls in the Gambia? The most trending health issue that is affecting them.
In 1 minute, please.
All right, thank you so much. So at the moment, we can say that is you have STIs. All right. You can also say sexual transmitted disease, that is STIs. You can also say reproductive health. All right. You have HIV and AIDS, which are sexual transmitted disease as well. So these are some of the things that are trending at the moment, which the making of reusable pad is not an exception. All right. So these are some of the things that are trending at the moment. Thank you.
Thank you so much. That brings us to the end of the question.
No, it does not. She said I should educate.
No, I will give you time for you to do that later. Yeah, that is. I will give both of you the closing remark. So Now I'm going to give you 2 minutes, all of you, to talk to Edusa, and this is going to be your final remark. So,
Okay.
2 minutes, please. Right?
Yes.
2 minutes.
Thank you very much for this opportunity. Edison's, this is your aspiring candidate, AWASI for Gender and Health. Just to remind you about my policy that I forgot to explain. When it comes to child welfare programs, remember the baby center, we have collaboration with the NAMI Foundation. This foundation already promises to bring ECD teachers from the college that are going to be teaching these children whilst their parents are in classroom. So to continue this trend, we want to continue impacting life on educants, especially mothers and children. To get back to what Aisha was saying, at this moment, if you look at women in the Gambia, there is one thing that is affecting us as women. It's either we are victims or we hear people talking about it. That is the use of what? Taba substance. Women are using it. We have little knowledge about it. We don't know the health complications attached to it. We don't know the side effects. So once we are in office, we want to make proper sensitization on the health impacts of the use of this tobacco. Men, you are also not an exception. Women are using this, so we need to have knowledge about it so that we can protect women and then the next generation. Thank you.
Thank you so much. Now, to Aisha, I'm giving you 2 minutes to talk to Edusa, and this is going to be your final remark. So whatever you want to say, make sure that is in these 2 minutes.
All right, thank you so much, Simon, once again. So, once again, I am Aisha Lusise, your aspiring candidate for Gender and Health under the most actionable, most competent team Renaissance. So, just to get back to my political opponent here, the number that is been established in 2020 is 1313. So this 1313 can be accessible to any individual that experience gender-based violence. So the reason I came up with this question is that in an event that we as a ministry, we are unable to solve this person's issue, we can actually refer the person back to people that can actually handle the situation. So thank you. And what I am going to tell Edusans is that vote for competence, vote for action-oriented individuals, vote for people that can represent you no matter what. Vote for people that can represent your affairs in any level. Look at the policies. Don't just be carried away by sympathy votes. You are great minds. You are nation builders. I always say this. No individual can actually determine the way you think. Your ways of thinking are different, are unmatched because you are matured. You are exceptional. So thank you so much, Fine TV. Thank you, Sir Umar, for hosting us. And thank you to all the masses for watching us from Fine TV.
Thank you so much. That brings us to the end of the program, and I thank the candidates for honoring our invitation, and thank all the viewers that are in the studio right now. We say shout out to you all for being here and with us. Thank you so much to the 15th Executive Council and the entire students of the University of the Gambia. So, Edusans, you heard from both candidates. Now the ball is in your court to decide who is going to be your next Gender and Health. And please make no mistake, select the right candidate for the job, because Edusans need the good minister to continue the job under the 16th Executive Council. So I'm your moderator, Seymour Fati, Information and Communication Minister, 15th Executive Council. Thank you.